Hi, I'm Alan Jeffrey. For over 15 years, I've been serving the patients, visitors, staff, and doctors at UC Irvine Medical Center, rated among the best hospital in the United States and home of many of America's top docs. I've gotten to know some really interesting people and have learned about the latest in surgical procedures and treatments in medicine. There are a lot of shows about the dirtiest jobs in the world. This is the first to look at the cleanest. Welcome to Cleanest Jobs with Alan Jeffrey.
Well, Alan, I want to introduce you to Tom Oring. I know you already know Tom.
Tom, good to see you again. How are you this morning?
Tom
Very
is
nice.
The man behind the robot, the Da Vinci behind Da Vinci, the creme de la creme. And he did the first robotic prostatectomy here in Southern California, and is a world's expert. So I'll leave you two guys alone.
Okay.
Whatever you do, don't lie down.
Okay. Thank you, Ralph. Sort of give me, in your terms, try to explain this in sort of a simple way. We know the type of surgery that used to be done. What happens now that you're using the Da Vinci?
Well, the Da Vinci is a very interesting product in that Dr. Clayman, as you know, was instrumental in the adoption of laparoscopic surgery. But the laparoscopic removal of the prostate was something that just wasn't catching on in the United States. It was too technically challenging and difficult. And the robot presented us with an interface that allowed an open surgeon who had done a lot of pelvic surgery with the big scalpel to now be able to do this laparoscopically. So I could sit down at a console and move the instruments just like I would move as if I was doing the surgery at the bedside, except we were doing it through small keyhole incisions.
Okay, so this is the part where the patient is in the operating room,
That's right.
but you're not here.
That's correct.
You're over there.
Right. So the console is actually just about 10 or 15 feet away.
Okay.
It could be in the next room, it could be in the next state, it could be in the next continent. It actually has been. In the United States, it's always in the same room, primarily.
Well, let me stop you on that again. Let me see if I heard that right. You could actually be here in California, you could be doing a surgery in Germany.
Yes.
Wow.
The major limitation is the time issue there, that you would move something and it would take quite a bit longer for it to happen, but there have been Da Vinci surgeries done across the Atlantic Ocean. A gallbladder was taken out actually across the Atlantic Ocean.
Wow.
The surgeon was in Europe.
Oh my God. It's hard to comprehend.
Well, again, the concept came from remote battlefield surgery. That was the idea, to not have the surgeon on the field. So that was what the initial concept was. But it didn't get moved along well enough. And then it went to the Stanford Research Institute, as Dr. Clayman has suggested previously. And the technology was then picked up by a company called Intuitive Surgical.
I see. Okay. So how long have you been using the Da Vinci? How new of a piece of equipment is this?
Well, the Da Vinci robot got FDA approval in the United States for just general types of use in 2000. And in 2001, at the Henry Ford Hospital in Detroit, this Dr. Menon actually did the first robotic prostate program, and we picked it up in 2002. So about 9 months after he started, we started. So June of 2002 was the first robotic prostate surgery done in Southern California. So this is the Da Vinci robot, and this is where I sit for the course of the operation, about 3 to 4 hours. And my right hand goes in this right hand instrument, and the left hand here. My right eye goes into the right goggle, the left eye goes in the left, and I can see in 3 dimensions. And I just push the thing to let me start moving, and the instruments will move. And when I want to move this right hand right, it goes right. And when I want to move it to left, I can interact. You can see here I can grab a suture and move and do suturing and do whatever I need to do. I can be extremely precise, and you'll see that there's no tremor. And I can feed this little guy right through like that if I want to, and you just grab it perfectly. We can
control the instrument very precisely. I can pull that without breaking it. I can actually see the string stretch, and I know not to pull too hard. Now again, if I wanted to break it, of course, I could break it easily if I wanted to. The robot, of course, is rather strong.
So I guess that's about it, Tom. That was really great. Very interesting being here today. I love learning about the Da Vinci robot and all the things that it can do. I don't think you're going to be able to show me how to use the robot today, but maybe you could leave me with a little bit of advice that I could take with me.
Well, the main bit of advice I would give you is I don't think Leonardo much cares for Da Vinci. His name was Da Vinci, Leonardo da Vinci.
Oh, Da Vinci. Okay, well, I got it. Okay, well, that wraps it up today. We've been here with Dr. Thomas Allering, and we've been learning about the capabilities of the Da Vinci robot. Well, that's it for Cleanest Jobs. I wanted to thank Dr. Rolf Klayman, Dr. Thomas Allering, and we especially had a lot of fun today on the Da Vinci robot. We'll see you here next time on Cleanest Jobs. How's it going this morning?
Good.
You can throw some cream in that?
Yeah.
Okay. There we go. Okay, hooked up here. There you are. Thanks. Have a great one, all right?
Did you already get hers?
She's got a medium decaf Americano, and then we've got a iced vanilla latte. Soy.
Iced vanilla latte soy.
Fire in some shots over there. Are we there? We're there. Okay. Remember where you found the cup, Dan?
I got a Well,
that wraps it up for today's version of Cleanest Jobs. Let's do it again. Good. Good. That one is.
And what it is here's the body of the patient, so you can't look down, it's not see-through.
Oh, okay, I gotta
So
look
you want
up
to keep
there.
your eyes here.
All right.
And this is your camera, so what I can do as your assistant, I can zoom in.
Hey, do that again, I like that.
Yeah.